Welcome back. One of the most important things you can do for your health is take care of your smile.
That's right. One thing you may have learned is that you shouldn't put off dental care. Here with more insight, Dr. Lindsay Hands of Modern Family Dentistry is with us. Okay, so it's National Children's Dental Health Month.
That's right.
How soon should you start taking your child to go see a dentist?
Sure. The ADA actually now recommends that you take your child in whenever the first tooth comes in, or at the very latest by 1 year of age.
Really?
Yeah.
That seems so early.
It is. It's really early when parents hear it. And the first visit is usually more for the parents. We talk about different things for education, how to properly care for your child's teeth. We talk about nutrition, development, normal development, and of course we answer any questions that the parents have, and then we try and just take a quick look at the child's teeth and make sure they're developing normally.
And that's an important distinction, I think, too, for some of our viewers, because some of the conventional wisdom has always been, well, they're baby teeth. Who cares if they come in and they rot or fall out because you have another set behind them, right?
Absolutely,
But the development of the teeth is important.
It's very important. You know, your child keeps most of their baby teeth. The last ones are not lost until they're 12 or 13 years old, so it's important to keep them in place, keep them healthy. That's how your child eats and chews and smiles and functions normally. Dental decay is actually the most common chronic childhood disease in the country, so it's really important to get your kids' teeth checked out and taken care of.
Yeah, so talk a little bit about those benefits of coming early when they're still babies.
Absolutely. It helps us as the dentist and dental team monitor and make sure everything's developing normally. It helps us catch problems while they're small, and so they're easier to fix. And really, most importantly, that my office sees, it really helps your child become comfortable at the dental office. You know, a lot of adult patients that I have are terrified of the dentist because either they didn't go when they were kids or they went once and they had a really, really bad experience. So helping your child come in, just sort of do small baby steps, get more and more comfortable with all of the weird equipment that we have in there, helps them realize that it's a normal place to go. They see mom and dad and brothers and sisters going. It just helps them understand that it's a positive place to be, a normal place to be, and then they're not afraid. They have a healthier relationship with the dentist as adults.
How do you help parents who've had bad experiences get through that to get their kids in the right frame of mind?
Yeah, you know, we just try to explain to them that, you know, your kid is kind of a sponge. They feed off of your attitude, and if they can see that you're scared, they're probably going to be scared. So just trying to use positive language. We always recommend, there's some great books out there to read about coming to the dentist for the first time that you can read to your child. And then, you know, having the child come in and observe you during something that's a pretty easy procedure, like getting your teeth cleaned. You know, that's something that usually goes pretty smoothly. So if your child can sit there and watch you do that and see that you're totally fine, then usually they have an easier time doing it.
Are you scary?
No.
Okay, I was just checking. I was like, you seem very friendly.
I'm a nice person.
That's good.
And
That's
then
good.
just let them get a little squirt on their teeth, play with the little suction
Exactly,
thing.
yeah. We let them play with the stuff, and you know, even if they don't want to open their mouth, we let them ride up and down in the chair a little bit, and then if that's all they want to do, we don't push, and then the next time they come in, maybe they're willing to do a little bit more. So that's how we kind of get them more comfortable in the office.
Okay, so some parents, like we were talking earlier, may not think cavities at a young age are that big of a deal. They're just going to lose those teeth anyway, but they really are something you need to take care of.
Absolutely. Cavities in baby teeth cause the same problems as cavities in adult teeth. They can cause pain, swelling, infection, all of those things that are a distraction from school. Yeah, absolutely.
Crowding, too. That's interesting. Crowding and future orthodontic problems.
Yeah, so if you lose a baby tooth before it's supposed to be lost naturally, what happens is the other baby teeth sort of crowd into that spot, and then the adult teeth that are above those teeth have a harder time coming in because the space hasn't been maintained for them. So losing baby teeth earlier than you're supposed to can cause crowding issues and orthodontic issues later on.
Yeah, and all I see with that are dollar signs.
Absolutely, yeah. So it's always cheaper to maintain healthy teeth than to have to replace bad teeth.
There you go.
Well, and I feel like, too, when you're looking at baby teeth that might have some decay or you're getting cavities or something along those lines, you're dealing with potential problems in training the kids, too, right?
Absolutely, yeah. And that's part of the reason that coming to the dentist is important, because we train the kids and also the parents in proper brushing techniques, how often to brush, how much time you need to take to brush, and the right way to do it.
Yeah.
All right, lots of great tips here from Dr. Lindsay Hands talking about the importance of dental care for your kids. We appreciate you coming in. Thank you
Yeah,
guys
really
so
good
much.
advice. And she's not scary.
Not at all. Hey,
Thank
if you want to
you.
connect with Dr. Hands and her team, be sure to visit CILiving.tv when this show is over.